Lee Health Orthopedic Surgeon Dr. Deanna Young says she sees many patients who have arthritis in their foot or ankle.
Sometimes if it's a more mild case of arthritis, people are still able to do their day-to-day activities, but once they start doing more challenging activities like sporting activities, it does start to bother them. They start to get pain. Sometimes they get swelling.
It stems from the joint deteriorating.
Some people get it and some people don't. We don't always know who does and who doesn't, but in some cases it is a little bit more predictable. So if someone's had an injury before, like a broken ankle, that can mean that later on in the future they end up getting arthritis of that ankle joint.
If a patient hasn't experienced arthritis before, she'll start by trying a nonsurgical approach.
Sometimes an injection can help, sometimes a different type of shoe wear or orthotic can help them.
For smaller joints with arthritis, the surgical treatment is usually fusion.
So what fusion is joining the two bones that are on either side of the joint together, letting those bones grow together and fixing them in place with some sort of hardware until the bone's solid enough, and then rehabilitating after that to get back into the day-to-day activities.
Ankle replacement is another surgical option. Dr. Young says the treatment is very individualized depending on the patient and their goals. Getting patients back on their feet so they can once again do what they love. For Lee Health, I'm Devin Turk.